Welcome to our comprehensive guide on healthcare ventures to consider in Angola. As a medical professional, I've always been drawn to places where the need for quality healthcare is great and the potential for impact is even greater. Angola is one such place. We're going to explore 15 innovative and impactful healthcare opportunities that can make a significant difference in the lives of Angolans. From strengthening primary care to leveraging the power of technology, these ventures address some of the most pressing health challenges facing the nation. Whether you're an entrepreneur, investor, or simply someone passionate about global health, I invite you to join me on this journey. Let's delve into the world of healthcare in Angola and uncover the transformative ventures that hold the key to a healthier future. The potential to make a real difference is immense, and the time to act is now. Our journey begins with the foundation of any strong healthcare system, primary care. In Angola, many, particularly those in rural areas, lack access to even the most basic medical services. This is where the opportunity for establishing primary healthcare clinics comes in. Imagine a network of small, strategically located clinics offering essential services, routine checkups, vaccinations, treatment for common illnesses, and management of chronic conditions like diabetes and hypertension. These clinics would become trusted pillars of their communities. By focusing on preventative care and early detection, these clinics can significantly reduce the burden of disease. They can also play a vital role in health education, empowering individuals to take control of their well-being. This proactive approach not only improves health outcomes but also alleviates pressure on secondary and tertiary care facilities. Now let's explore the transformative power of technology in healthcare. Angola, with its vast and often challenging terrain, stands to benefit enormously from telemedicine. Imagine a doctor in Luanda being able to consult with a patient hundreds of miles away in Huambo province all through a secure video call. Telemedicine can effectively bridge the gap in healthcare access for remote and underserved communities. It allows patients to consult with specialists who may not be physically present in their region, reducing the need for costly and time-consuming travel. But the benefits go beyond just consultations. Telemedicine can facilitate remote patient monitoring, allowing healthcare providers to track vital signs, medication adherence, and overall progress. This is particularly valuable for managing chronic conditions like diabetes and hypertension. Across the globe, access to essential medications is paramount to a functioning healthcare system. However, in many developing nations this access is limited. Angola, despite its strides in healthcare, still faces significant challenges in ensuring that life-saving drugs reach those who need them most. Geographical barriers, inadequate infrastructure, and complex supply chains all contribute to this pressing issue. The consequences of this gap are profound. Patients with treatable conditions may face disease progression, complications, or even death due to the lack of readily available medication. This underscores the urgent need for robust and efficient pharmaceutical distribution networks throughout the country. Investing in this sector has the potential to dramatically improve health outcomes. Imagine living in a village, hours away from the nearest clinic or hospital. For many Angolans, this is a harsh reality, and it poses a significant barrier to accessing even basic healthcare services. This is where the innovative concept of mobile health clinics comes into play, offering a beacon of hope to underserved communities. These clinics on wheels are essentially compact medical centers equipped with essential diagnostic and treatment equipment. Staffed by dedicated healthcare professionals, they travel to remote villages and communities, bringing healthcare directly to those who need it most. This eliminates the need for long and often costly journeys to urban centers, removing a significant barrier to care. But the impact of mobile health clinics extends far beyond just providing basic medical services. They also play a crucial role in preventive care, offering services like immunizations, health screenings, and educational outreach programs. In the world of medicine, accurate and timely diagnosis is paramount. It's the critical first step in determining the most effective course of treatment and ensuring the best possible outcomes for patients. Yet, in many parts of the world, including Angola, access to reliable and comprehensive diagnostic services remains a significant challenge. The lack of adequate diagnostic facilities can have far-reaching consequences. Without the ability to accurately identify diseases and conditions, healthcare providers are essentially working in the dark. This can lead to misdiagnosis, delayed treatment, and potentially avoidable complications. Investing in and strengthening Angola's network of diagnostic laboratories is therefore not just about purchasing sophisticated equipment, it's about investing in a fundamental pillar of a robust healthcare system. As we delve deeper into the healthcare landscape of Angola, we encounter a critical need: the availability of essential medical equipment. Hospitals and clinics across the country often face shortages of vital tools and technology, hindering their ability to provide quality care. Imagine a doctor unable to perform a life-saving ultrasound due to a lack of equipment or a hospital bed shortage, forcing patients to be turned away. This is the reality for many healthcare providers in Angola. Investing in medical equipment supply can bridge this gap. By importing, selling, and maintaining a range of equipment, from ultrasound machines to diagnostic tools and hospital beds, we can empower healthcare professionals to deliver effective treatment. Moreover, providing comprehensive training programs on the use and maintenance of this equipment is crucial. By equipping healthcare workers with the right tools and knowledge, we can significantly enhance the quality of care across Angola. Access to quality healthcare shouldn't be a luxury. Yet for many Angolans, the high cost of healthcare poses a significant barrier. Out-of-pocket expenses for doctors' visits, medications, and hospital stays can be financially devastating. This is where the power of health insurance comes in. By providing financial protection against these costs, we can make healthcare accessible to a larger segment of the population. Developing affordable health insurance plans tailored for low and middle-income populations is key. These plans should cover essential healthcare services including preventive care, consultations, hospitalization, and medications. By easing the financial burden of healthcare, we can empower individuals to prioritize their health and well-being without jeopardizing their financial stability. Every child deserves a healthy start in life, and every mother deserves access to quality care during pregnancy and childbirth. Sadly, in Angola, maternal and infant mortality rates remain alarmingly high. This highlights a critical need for specialized maternal and child health centers equipped to provide comprehensive care throughout pregnancy, childbirth, and early childhood. These centers should offer a range of services, including prenatal checkups, nutritional counseling, safe delivery services, postnatal care, and immunizations. By focusing on early detection, preventive care, and timely interventions, we can significantly reduce preventable deaths and improve health outcomes for mothers and babies. We often take for granted the ability to call 911 and receive immediate medical attention, a service that is so ingrained in our daily lives that we rarely stop to think about its importance. This system, which connects us to emergency responders within seconds, is a lifeline that can mean the difference between life and death in critical situations. Whether it's a car accident, a sudden illness, or a natural disaster, the assurance that help is just a phone call away provides a sense of security and peace of mind. But in many parts of the world, this is simply not a reality. In numerous rural and underdeveloped regions, the concept of emergency medical services is either rudimentary or entirely non-existent. The infrastructure that supports such a system, ambulances, trained personnel, and communication networks, is often lacking or severely underfunded. This absence creates a significant gap in healthcare delivery, leaving millions vulnerable and without access to timely medical intervention. In Angola, the lack of a robust emergency medical services system is a critical gap in the healthcare infrastructure. The country faces numerous challenges, including vast rural areas with difficult terrain, limited healthcare facilities, and a shortage of trained medical professionals. These factors combine to create a situation where emergency medical care is often out of reach for those who need it most. The consequences of this gap are dire, with preventable deaths and untreated injuries becoming all too common. When accidents happen or medical emergencies arise, the ability to get timely care can be the difference between life and death. In urban areas with well-established EMS systems, response times are measured in minutes. However, in rural Angola, it can take hours or even days for help to arrive, if it comes at all. This delay can be fatal, particularly in cases of severe trauma, heart attacks, strokes, and other time-sensitive conditions. The lack of immediate medical attention exacerbates the suffering of patients and their families, who are left to cope with the consequences on their own. Imagine a scenario where someone suffers a heart attack in a rural village. The nearest medical facility is miles away, and there is no ambulance service to transport the patient. Villagers do their best to help, but without proper medical training or equipment, their efforts are limited. The patient's family watches in anguish, knowing that every passing minute reduces the chances of survival. This is not an isolated incident, but a daily reality for many communities in Angola and other similar regions around the world. Without access to an ambulance or trained medical professionals, their chances of survival are significantly reduced. The rough and often impassable roads further complicate the situation, making it difficult for any form of transportation to reach those in need. Even when an ambulance is available, the lack of proper equipment and trained personnel means that the level of care provided is often inadequate. This systemic issue highlights the urgent need for a comprehensive and well-coordinated EMS system that can respond effectively to emergencies, regardless of location. Or consider a pregnant woman experiencing complications during labor, miles away from the nearest hospital. In developed countries, such a situation would prompt an immediate response, with an ambulance and a team of medical professionals arriving swiftly to provide the necessary care. However, in rural Angola, the lack of resources and infrastructure means that the woman and her unborn child are at significant risk. The journey to the hospital, if undertaken, is fraught with challenges, and the outcome is uncertain. This scenario underscores the critical need for accessible and reliable emergency medical services. Miles away from the nearest hospital, the isolation of rural communities exacerbates the healthcare crisis. The long distances and poor road conditions make it difficult for patients to reach medical facilities in time. Even when they do, the hospitals are often under-resourced and overwhelmed, struggling to provide adequate care. This isolation not only affects emergency medical services, but also impacts routine healthcare, leading to higher rates of preventable diseases and complications. The disparity in healthcare access between urban and rural areas is stark, and addressing this gap is essential for improving overall health outcomes. These are the harsh realities for many Angolans. The lack of a functional EMS system is a symptom of broader healthcare challenges that the country faces. From inadequate funding and resources to a shortage of trained healthcare professionals, the obstacles are numerous and complex. The impact on the population is profound, with many people unable to access the care they need when they need it most. This situation calls for urgent action and investment to build a healthcare system that can meet the needs of all Angolans, regardless of where they live. Developing a reliable EMS system requires more than just ambulances. It necessitates a comprehensive approach that includes training, infrastructure, and community engagement. Ambulances are a critical component, but they are only effective if they are part of a well-coordinated network that includes trained paramedics, efficient dispatch systems, and accessible medical facilities. Building such a system requires significant investment and a long-term commitment to improving healthcare delivery. It also involves collaboration between government agencies, non-profit organizations, and local communities to ensure that the system is sustainable and responsive to the needs of the population. It necessitates a network of trained paramedics and dispatchers who are the backbone of any effective EMS system. These professionals need to be equipped with the skills and knowledge to respond to a wide range of emergencies, from trauma and cardiac events to childbirth and infectious diseases. Continuous training and professional development are essential to ensure that they can provide the highest level of care. Additionally, a well-functioning dispatch center is crucial for coordinating responses and ensuring that help arrives as quickly as possible. This requires investment in technology and communication systems that can support real-time decision-making and resource allocation, as well as well-equipped medical facilities capable of handling a wide range of emergencies. These facilities need to be strategically located to ensure that they are accessible to both urban and rural populations. They should be equipped with the necessary medical equipment and supplies to provide comprehensive care, from initial stabilization to advanced treatment. This includes everything from basic first aid supplies to advanced life support equipment. Ensuring that these facilities are staffed with trained medical professionals is also critical, as they are the ones who will ultimately provide the care that patients need. It also requires community education so people know how and when to access these vital services. Public awareness campaigns and community outreach programs can play a significant role in educating people about the importance of emergency medical services and how to use them effectively. This includes teaching basic first aid skills, recognizing the signs of medical emergencies, and understanding how to contact emergency services. Empowering communities with this knowledge can help to bridge the gap in healthcare access and ensure that more people receive the care they need in a timely manner. By working together, we can build a more resilient and responsive healthcare system that serves everyone, regardless of where they live. One of the most pressing challenges facing Angola's healthcare system is a critical shortage of trained professionals. This issue is not just a minor inconvenience, it is a significant barrier to providing adequate healthcare services to the population. The shortage spans across various roles within the healthcare sector, creating a bottleneck that affects the entire system. From doctors and nurses to lab technicians and community health workers, the demand for skilled healthcare workers far outpaces the current supply. This imbalance means that many healthcare facilities are operating with skeleton crews, often forcing existing staff to work long hours under stressful conditions. The lack of personnel also means that patients may experience longer wait times, reduced access to specialized care, and overall lower quality of healthcare services. This shortage has a ripple effect throughout the entire system, limiting access to care and impacting the quality of services provided. When healthcare workers are stretched too thin, it becomes challenging to maintain high standards of care. This can lead to increased rates of medical errors, lower patient satisfaction, and ultimately, poorer health outcomes for the community. The strain on the system also discourages new talent from entering the field, perpetuating the cycle of shortage. Addressing this shortage requires a multi-pronged approach, and investing in healthcare training institutes is a vital piece of the puzzle. These institutions play a crucial role in developing a pipeline of skilled professionals who can meet the growing demands of the healthcare sector. By providing comprehensive education and hands-on training, these institutes can equip students with the knowledge and skills they need to excel in their roles. By establishing institutions dedicated to educating the next generation of healthcare professionals, Angola can begin to close this gap and build a more sustainable healthcare workforce. These training programs should be designed to address the specific needs of the Angolan healthcare system, ensuring that graduates are well prepared to tackle the unique challenges they will face in their careers. These training institutes should offer a wide range of programs tailored to the specific needs of the Angolan healthcare system. This includes not only traditional medical and nursing degrees, but also specialized courses that address the full spectrum of healthcare roles. By diversifying the types of training available, these institutes can produce a well-rounded workforce capable of meeting the diverse needs of the population. This includes traditional medical and nursing degrees, which are the backbone of any healthcare system. These programs provide the foundational knowledge and clinical skills necessary for doctors and nurses to deliver high-quality care, as well as specialized courses for lab technicians, pharmacists, and other allied health professionals. These roles are equally important in ensuring the smooth operation of healthcare facilities. Lab technicians, for example, play a critical role in diagnosing diseases and monitoring patient health, while pharmacists ensure that medications are used safely and effectively, and other allied health professionals. These specialized training programs can help fill gaps in the healthcare workforce, ensuring that all aspects of patient care are covered. By offering a variety of educational pathways, Angola can create a more versatile and resilient healthcare system. Equally important is the need for ongoing professional development opportunities to ensure healthcare workers stay up to date with the latest medical advancements and best practices. Continuous education is essential for maintaining high standards of care and adapting to new challenges as they arise. By investing in both initial training and ongoing professional development, Angola can build a healthcare workforce that is not only larger, but also more skilled and adaptable. While we often focus on physical health, mental health is equally important to overall well-being. Unfortunately, mental health is often stigmatized and under-resourced, particularly in developing countries like Angola. The reality is that mental health disorders are common, affecting millions around the world, and Angola is no exception. The psychological impact of poverty, conflict, and displacement, coupled with limited access to mental health services, has created a silent crisis in Angola. Conditions like depression, anxiety, PTSD, and substance abuse are prevalent, yet often go undiagnosed and untreated. This lack of access to mental health services has far-reaching consequences. Untreated mental health conditions can lead to social isolation, unemployment, family breakdown, and even suicide. It's a tragic irony that while mental health issues are often invisible, their impact is profound and far-reaching. As Angola continues its economic development, we're seeing a shift in disease patterns. Just like in many parts of the world, chronic conditions like heart disease, diabetes, and certain types of cancer are on the rise. This is often linked to lifestyle factors like lack of physical activity, unhealthy diets, and stress. That's where fitness and wellness centers come in. They offer a proactive approach to health, focusing on prevention and healthy lifestyle changes. Imagine gyms equipped with modern cardio and strength training equipment, yoga studios offering a variety of classes, and wellness centers providing nutritional counseling and stress management techniques. These centers can play a crucial role in creating a culture of wellness in Angola. They can become community hubs where people not only exercise but also receive education on healthy living, connect with others, and participate in group fitness classes, making healthy habits more engaging and sustainable. Angola has a rich history of traditional medicine, with generations passing down knowledge of medicinal plants and their uses. This traditional knowledge base is a valuable resource, especially when combined with modern scientific research and production methods. Imagine creating a venture that taps into this potential. By cultivating and processing locally sourced medicinal plants, Angola could produce a range of herbal medicines. Think of herbal teas to alleviate common ailments, creams and ointments for skin conditions, and even standardized herbal extracts for more potent therapeutic effects. Of course, safety and efficacy are paramount. Establishing rigorous quality control measures throughout the production process is essential. This includes proper identification and sourcing of plants, standardized extraction methods, and laboratory testing to ensure product quality and safety. Now let's talk about the incredible potential of mobile technology in healthcare, especially in a nation like Angola, where mobile phone usage is rapidly increasing. Imagine the possibilities of putting health information, resources, and even medical consultations right in the palm of someone's hand. We're talking about developing health-focused mobile applications, apps that can provide health education, schedule appointments, offer medication reminders, and even help with symptom checking. These tools can empower individuals to take control of their health, leading to better health outcomes. Think about it for a moment from the perspective of someone living in a remote village. Without easy access to a clinic, a simple app could connect them with a doctor hundreds of miles away for a virtual consultation. Or it could provide crucial information about disease prevention and early detection. The beauty of this approach is its scalability. With the right app, we can reach millions of people across Angola, bridging geographical barriers and improving healthcare access for all. Let's shift gears now to another critical aspect of healthcare access to clean water. Water is the essence of life, a basic necessity that sustains us all. Yet, for many people around the world, access to clean and safe drinking water is not a given. It's a daily struggle, a challenge that impacts their health, their livelihoods, and their futures. In many parts of the world, clean water is a luxury that is often out of reach. This is particularly true in rural areas where infrastructure is lacking and resources are scarce. The situation is dire, and the need for action is urgent. It's easy to take clean, safe drinking water for granted, but in many parts of the world, it's a luxury. Imagine waking up every day knowing that the water you drink could make you sick. Imagine having to walk miles just to find a source of water, and then having to carry it back to your home. This is the reality for millions of people around the world. Access to clean water is not just about quenching thirst, it's about ensuring health, dignity, and a better quality of life. It's about giving people the opportunity to thrive, to pursue their dreams, and to build a better future for themselves and their families. The reality is that access to clean water is not just a matter of convenience, it's a fundamental human right with profound implications for public health. Clean water is essential for preventing diseases, promoting hygiene, and ensuring the well-being of communities. Without it, people are vulnerable to a host of waterborne illnesses that can be debilitating and even deadly. Children are particularly at risk, as their developing bodies are more susceptible to the harmful effects of contaminated water. The elderly and those with weakened immune systems are also at greater risk. Ensuring access to clean water is a critical step in protecting the health and well-being of these vulnerable populations. In Angola, where access to clean water remains a challenge, particularly in rural areas, we have a responsibility to find innovative and sustainable solutions. The lack of clean water in these areas is a major barrier to development and progress. It affects every aspect of life, from health and education to economic opportunities and social stability. But there is hope. By investing in water infrastructure, promoting water conservation, and implementing effective water management practices, we can make a real difference. We can bring clean water to those who need it most and help build a brighter future for all Angolans. Waterborne diseases are a major health concern, and contaminated water can lead to a range of illnesses, especially in vulnerable populations like children and the elderly. These diseases can cause severe dehydration, malnutrition, and even death. They place a heavy burden on healthcare systems and hinder economic development. But the good news is that many of these diseases are preventable. By ensuring access to clean water and promoting good hygiene practices, we can significantly reduce the incidence of waterborne illnesses. We can save lives, improve health outcomes, and create healthier, more resilient communities. The good news is that there are a number of effective and affordable water purification technologies available. These technologies can remove harmful contaminants from water, making it safe to drink. They range from simple household filters to more advanced community filtration systems. By investing in these technologies and making them accessible to those who need them, we can ensure that everyone has access to clean, safe drinking water. We can empower communities to take control of their water supply and improve their health and well-being. From simple household filters to larger-scale community filtration systems, we can make a real difference in the lives of millions of Angolans. These solutions are not only effective but also sustainable. They can be maintained and operated by the communities themselves, ensuring long-term access to clean water. By working together, we can create a future where clean water is available to all, where no one has to suffer from the effects of contaminated water. It's a future where everyone has the opportunity to live a healthy, fulfilling life. Imagine a future where every child in Angola has access to safe drinking water, where waterborne diseases are a thing of the past. Imagine a future where communities are thriving, where children are healthy and able to attend school, where families are free from the burden of water-related illnesses. This is the future we can create if we commit to ensuring access to clean water for all. It's a future where everyone has the opportunity to reach their full potential, to build a better life for themselves and their families. It's a future worth striving for, and it's within our reach. By working together, we can make it a reality. We can bring clean water to every corner of Angola, ensuring that everyone has access to this fundamental human right. We can create a world where clean water is not a luxury, but a given. A world where everyone has the opportunity to live a healthy, fulfilling life. Let's commit to making this vision a reality. Let's work together to ensure that everyone has access to clean, safe drinking water. It's a goal worth striving for, and it's one that we can achieve if we work together. Thank you for joining me on this journey exploring the vast potential of healthcare ventures in Angola. From establishing primary care clinics and telemedicine services, to empowering communities with clean water and health-focused mobile apps, the opportunities to make a difference are abundant. Remember, healthcare is not just about treating illness, it's about investing in people, building healthier communities, and creating a brighter future for all. We've only just scratched the surface of what's possible. I urge you to share these ideas, explore these opportunities, and join us in our mission to transform healthcare in Angola. Together, we can make a lasting impact. Don't forget to like, share, and subscribe for more insightful content.